Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Lamotrigine. Lamotrigine is a sodium channel blocker, and it is also T type of calcium channel blocker. So this lamotrigine is used as a monotherapy in generalized tonic-clonic seizures. It is used as a monotherapy in partial seizures. It is a major anticonvulsant which is used. The side effects of the lamotrigine can cause rashes and hypersensitivity reactions are seen with lamotrigine. Especially lamotrigine can result in an important side effect, which is Steven Johnson syndrome is found to be noted with lamotrigine. Then lamotrigine can be used as a mood stabilizer also, and it is also an anti-neuropathic agent. Then lamotrigine is also used in uses. So if you see the uses of lamotrigine are, we have, it can be used in bipolar pain, sorry, it can be used in bipolar disorder, and it can be used in any type of neuropathic pain. It can be used in depressive phase of mania, especially in a patient with depressive psychosis. We can use this lamotrigine.
thank you and thank you for watching.